I'm sure that all of us remember the day COVID-19 changed our life. In Brussels, where I live, the lockdown started in March, on Friday the 13th, and we are still not back to normal after all these months. The pandemic has put a spotlight on the weaknesses of our healthcare systems, but at the same time, it has shown us what is working well. The dedication of our healthcare professionals, their openness to innovation, and their willingness to collaborate in the interests of society. Looking back, the key lesson to remember is that the only way to conquer the virus is by collaborating across the public and private sector. Prioritizing health and investment in healthcare are the keys to unlock us from being in this situation in the future. The Gaidar Forum, with an extensive healthcare agenda, is the best proof of Russia moving into this direction. Let me provide some perspective from how COVID-19 has impacted the European integration. At the beginning of the crisis, the EU closed their external borders. A bit later, several EU countries closed their own borders. However, a couple of days later, the EU reopened its borders and created green lanes for trucks to deliver medicines, food, and other essentials. Quickly after these initial reactions, the EU countries have been working more closely together. It became clear to local governments that acting as one European force provides more strength to fight the virus. We are facing an unprecedented challenge, and we need solutions to be able to overcome it and be ready for a possible next pandemic. Governments understand this, and a lot of transformation is happening right now. To give you a concrete example, in the EU last month, they launched a proposal to develop a European Health Union. The ambition is that it will help all EU countries to improve the resilience of their healthcare systems. As one of the leading healthcare companies, Janssen is looking to collaborate with governments and other stakeholders to make these transformations a reality. It sounds like a no-brainer, but we need to agree that good health is an important economic driver that impacts our overall well-being, and therefore it needs prioritization. To return to sustainable growth, the number one priority is to shift from a focus on healthcare spending towards seeing it as an investment. In Europe, the newly adopted European health budget represents a more than tenfold increase from the current budget. This comes on top of investment individual European countries are putting into their healthcare systems. We know that currently Russia invests around 3 to 4% of their GDP in health. This number is lower than some Eastern European countries. Based on the COVID lessons learned, we hope to see a gradual growth in health investment in the future. A second element that can contribute to sustainable growth is creating an ecosystem that stimulates the development of innovative interventions, whilst ensuring rapid access to these for patients. The coronavirus has accelerated innovation in our search to diagnostics, vaccines, and therapeutics. But also over the last years, innovation in healthcare played an important role in improving the survival rate and quality of life for patients with several diseases. Many diseases that earlier were synonymous to a death sentence now can be managed, controlled, and sometimes even cured. Thirdly, innovation would not be possible without an effective intellectual property rights protection system. The amount of research and development currently ongoing to overcome the COVID-19 pandemic demonstrates that IP cannot be considered as a barrier to access to innovation, but rather as a driving force for its development. To enable sustainable growth, it will be important that potential threats undermining the intellectual property systems will be diminished. Governments will have to use the resources that are available as efficiently as possible. They need to consider the long-term outcomes of investment in health versus a short-term cost containment approach. The austerity measures taken after the 2008 financial crisis had very detrimental effects on health and social well-being in Europe. Investing in healthcare systems will only be sustainable if it funds worthwhile interventions, cutting inefficiencies and achieving meaningful outcomes for patients. According to the OECD, up to 1/5 of healthcare expenditure is wasted, partly due to spending on interventions that do not deliver the best outcomes for patients. We believe that the use of real-world data by healthcare systems has the potential to transform every aspect of healthcare, from approval processes for innovative new medicines to day-to-day clinical practice. Making better use of real-world data will enable healthcare systems to adopt new outcomes-based models of funding where spending can be targeted on the interventions that deliver the greatest value. We need to shift from a fee-for-service to a fee-for-outcome model that puts value for patients at the center stage whilst taking broader societal and economic gains into account. If we can make this value-based approach to healthcare a reality, it will help to optimize budgets and resource allocation decisions. And furthermore, it will allow to reinvest potential savings into higher value care. There are several challenges in the use of healthcare data in Europe. The lack of interoperability of the systems where data is held, the lack of standards to ensure that data is of sufficient quality, and the lack of sustainable governance frameworks for data sharing. I understand that Russia is dealing with the same challenges. Yet we see some acceleration of digital health due to COVID-19. But currently only 20% of data collected in health is being reused, so there is a huge room for improvement here. Rapid adoption of telemedicine during Europe's lockdown also has the potential to further accelerate the digitization of healthcare systems and support stronger data collection. I know also in Russia there are good examples. We should continue to strengthen the collaboration between pharmaceutical industry, key decision makers, patients, and healthcare professionals to increase access to real-world healthcare data. Janssen is already collaborating in several projects to increase access to this data, including through the European Union's Innovative Medicines Initiative. We are leading the European Health Data and Evidence Network, which seeks to harmonize around 100 million electronic health records for real-world data research. We have set up a federated network called Hematology Outcomes Network in Europe, HONEUR, and within this network we partner with universities and hospitals to analyze real-world data quickly and at scale from as many sources as possible. Several Russian medical centers in Moscow and St. Petersburg have also agreed to participate. Let me be ambitious and have a wish list of 4 key priorities I would like to see happen in 2021. First of all, smarter and value-based investments in health. Secondly, acceptability of real-world evidence for healthcare decision-making. Thirdly, higher availability of innovative pharmaceutical solutions and technologies for patients. And lastly, but not least importantly, keep the spirit of collaboration between public and private sector to make healthcare systems future-proof. Spasibo za brij la génie.